Gentlemen, let me start with a scene I have witnessed more times than you might expect. A man in his late 60s wakes up on a quiet Saturday morning, sunlight pooling at the edge of the curtains. He stretches surprised to find that old familiar firmness, saying hello before his feet even touch the floor. He chuckles because for years he was told that this part of life is supposed to fade. Yet here it is, reliable, reassuring, alive. Another scene, a couple in their early 70s, Friday night soft music, the scent of her favorite lavender on the pillow. They are unhurried, playful, confident. He is present and steady from start to finish, not a fluke, not a good night, but the new normal. On Monday morning, he tells me in clinic, "Doc, I feel 20 years younger, but my birth certificate still says 71. So what is going on? What are these men doing differently? Is there a blueprint the rest of us can follow?" Here is the truth: age matters, but it is not destiny. The biology of erections is wired through the heart, the metabolism, and the architecture of sleep. When those three line up: blood pressure in a healthy range, blood sugar, steady and deep restorative sleep, your body sends a strong, consistent message to the bedroom. If you have been blaming birthdays alone today, I invite you to look deeper. In part two, I will show you exactly how the heart, metabolism, and sleep team up so you can start steering them on purpose. Let us keep this simple and practical. Erections are a blood flow story. The lining of your blood vessels, the endothelium, releases nitric oxide, a natural open sesame that tells arteries in the penis to relax and let blood rush in. When your endothelium is healthy, nitric oxide is plentiful, and the on-ramp to an erection is wide and smooth. Metabolism joins the story. When blood sugar swings up and down, when insulin stays high, low-grade inflammation quietly smolders. That inflamed environment reduces nitric oxide, stiffens arteries, and dulls nerve signals. Keep blood sugar steady, and you calm inflammation, protect the endothelium, and preserve sensitivity. Now add blood pressure. Years of elevated pressure nick and scrape the blood vessel lining. Bring pressure back to a healthy range, and you protect that delicate surface, making it easier to respond when desire shows up. Finally, sleep. In deep and REM sleep, your brain and body run nightly maintenance. Testosterone pulses naturally, and nighttime erections occur like a rehearsal for later, keeping tissues oxygenated and responsive. Miss sleep, snore heavily, or stop breathing with sleep apnea, and the body's rehearsal time disappears. Fatigue rises, stress hormones crowd the stage, and performance follows. A calm mind ties it together. Less performance anxiety means more parasympathetic rest and respond tone, exactly what erections require. Many men over 50 who stay strong are not lucky. They are aligned pressure, steady sugar, smooth sleep, deep anxiety, lower medications tuned, and lifestyle dialed in. In part three, I will reveal 4 natural secrets, everyday strategies, backed by real-world data that pull these levers in your favor. Here is the roadmap men tell me changed everything, not overnight, but in weeks to months, reliably and sustainably. Blood pressure and vascular tune-up, aerobic movement, modest resistance training, and a smart plate dash or Mediterranean-style lower blood pressure, reduce arterial stiffness, and protect your endothelium. More open vessels, more nitric oxide, better inflow. Sugar control and insulin sensitivity, reset, low glycemic meals rich in fiber and protein, plus short walks after eating, smooth blood sugar, and reduce silent inflammation. Better insulin sensitivity often translates to more nitric oxide availability and improved nerve function. Sleep architecture upgrade and apnea screening. 7 to 8 hours of consistent, high-quality sleep, especially REM, supports natural testosterone rhythms and maintains nighttime erections. If you snore loudly or feel sleepy during the day, screening for sleep apnea can be a game changer. Autonomic calm pelvic floor and lifestyle boundaries. Slow breathing, Kegel training done correctly, and practical limits on evening alcohol and nicotine tilt the nervous system toward rest and respond, reduce vascular constriction, and improve initiation and staying power. These 4 are not a replacement for medical care or medications like PDE5 inhibitors. They are powerful levers that often reduce dependence, raise baseline performance, and increase confidence. Think of them as the foundation that makes everything else work better. In part 4, I will walk you through each secret, what it is, how it works, The friendly evidence, a real patient story, and step-by-step instructions you can start tonight. What it is. This secret is about training your blood vessels to act young again. It combines aerobic activity like brisk walking or cycling resistance training, 2 full-body sessions per week, and vascular-friendly eating. DASH or Mediterranean patterns, more potassium-rich produce and lower sodium. Add nitrate-rich vegetables, beets, arugula spinach, which your body converts into nitric oxide, the signal that opens penile arteries. How it works for erections. Healthy endothelium, shishings, healthy erections. Aerobic movement increases shear stress, the gentle friction of blood over vessel walls that stimulates nitric oxide release. Resistance training improves insulin sensitivity and lowers resting blood pressure, protecting the endothelium. Potassium helps relax vessels. Reducing sodium lowers pressure. Nitrate-rich foods provide the raw material for nitric oxide. Together, these changes restore that open doorway so blood can surge in when arousal begins. Evidence in friendly language. In clinical settings, men who combine aerobic and resistance training with a DASH-style plate often see noticeable improvements in erectile quality within 8 to 12 weeks. In approachable numbers. In a clinical study, men experienced an average increase of 3 to 5 points on the IIF-5 after 8 to 12 weeks, with noticeable gains in erection hardness score and improved penile blood flow on Doppler. Blood pressure reductions of 10 to 20 millimoles systolic are common with consistent effort, which directly eases stress on vessel lining. Patient story. Mr. Harry, 63 James, arrived tired with rare morning erections and mild shortness of breath when he and his wife were intimate. Baseline blood pressure, 148/88. We agreed on 150 minutes per week of brisk walking, 2 light resistance sessions, a DASH leaning plate, and a daily glass of beetroot and citrus. After 10 weeks, he reported steady morning erections, less breathlessness, and more confidence. His blood pressure read 128/78. His IIF-5 rose by 4 points, and his erection hardness score improved from mostly firm to reliably firm. Docky grinned. Friday nights are fun again. How to apply. Aerobics start with 20-30 minutes of brisk walking 5 days a week. Work toward a pace that leaves you slightly winded but able to talk. Resistance 2 sessions weekly, push-pull, hinge, squat, and carry. Light dumbbells, bands, or body weight. Plate half vegetables and fruit, a quarter lean protein. Fish, poultry, legumes, a quarter whole grains. Aim for 2 to 3 potassium-rich servings, daily tomatoes, leafy greens, and limit sodium to what you sprinkle with intent. Nitrate foods, add 1 small beet or 1 cup of leafy greens most days. Timing with meds. If you take blood pressure pills, check home readings. Partner with your clinician to avoid pressure dropping too low. Interactions and cautions. Nitrate-rich foods are food, not nitrate pills. If you use PDE5 inhibitors, do not combine with nitroglycerin or nitrate medications. If you are on blood thinners, discuss any new concentrated beet powders with your doctor. When to see a doctor: chest discomfort with exertion, dizziness, pressure, 160 with symptoms, or ED that begins suddenly. Tonight's checklist: 15-20-minute evening walk after dinner. Add a leafy green side or beet salad. Set 2 resistance days on your calendar. Measure your blood pressure at home 3 times this week. With the vascular doorway opening, the next step is to quiet the fire that closes it: unstable blood sugar and insulin resistance. What it is. This secret keeps blood sugar smooth and insulin responsive. Think low glycemic, high fiber meals with enough protein, smart fats, and colorful plants. Add a 10-15-minute walk after meals to shuttle glucose into muscles. 2 to 3 full-body strength sessions per week amplify insulin sensitivity. Some men discuss L-citrulline or L-arginine with their doctors as an extra push for nitric oxide production when appropriate. How it works for erections, glucose spikes, and high insulin fuel, chronic inflammation, and oxidative stress, both enemies of nitric oxide and nerve health. Smooth the curve and you preserve endothelial function and restore nerve signaling. Strength training increases muscle glucose sink, creating a steadier metabolic backdrop for sexual function. Citrulline and arginine can supply substrate for nitric oxide synthase, nudging vessels to relax. Evidence in friendly language. Men who stabilize blood sugar with a Mediterranean-style plate in post-meal walking often notice more predictable erections within 8 to 12 weeks. In a clinical study, men saw an average 3 to 5-point increase on the IIF5 and better erection hardness scores after combining low glycemic eating with regular activity. In those with type 2 diabetes, small improvements in HbA1c paired with consistent exercise can align with better penile, Doppler peak systolic velocity, a practical proxy for inflow. Patient story: Mr. Ryan, 59, Robert lived with type 2 diabetes, high blood pressure, and a statin. We kept his medications, then added a Mediterranean eating pattern, 10-15-minute walks after meals, and resistance bands twice weekly. Over 12 weeks, his HbA1c nudged down, home pressure steadied, and his IIEF5 climbed by 5 points. A follow-up Doppler showed improved PSV, and he needed a lower dose of his PDE5 inhibitor to achieve the same effect. Feels less like a coin toss, more like a plan, he said. How to apply: plate pattern. Build meals around fiber plus protein. Beans or lentils, fish or chicken, Greek yogurt or tofu with olive oil and nuts. Limit refined flours and sugary drinks. After meal, walk 10-15 minutes within 30 minutes of finishing, especially dinner. Strength: 2 to 3 full body sessions per week, 6 to 10 total sets, controlled tempo. Supplements only if appropriate. Discuss L-citrulline, 1,503 nanomolar day, or L-arginine, 2,103 nanomolar day with your clinician. Interactions and cautions. If you use insulin or sulfonylureas, monitor for low sugars when adding activity. If you take blood pressure meds or anticoagulants, review any supplement plans with your doctor. Never combine PDE5 inhibitors with nitrate medications. When to see a doctor: new numbness or burning in feet, unexplained weight loss, very high or very low readings, or ED that worsens rapidly. Tonight's checklist: swap white rice or bread for beans and leafy greens. Take a 10-minute stroll after dinner. Prep tomorrow's protein and fiber, e.g., Greek yogurt plus berries. If curious about citrulline arginine, send your doctor a quick message first. Before we dive into secret number 3, if this is speaking to you, hit like and subscribe. I have a free one-page erection-friendly habits checklist linked below. Print it and keep it on your nightstand. You have opened vessels and steadied sugar. Now let's restore the nightly rehearsal that keeps everything responsive: your sleep. What it is. This secret protects 708 hours of high-quality sleep with consistent bed and wake times, cool and dark rooms, morning daylight exposure, caffeine curfews, and device wind-downs. If you snore loudly, stop breathing at night, or feel sleepy during the day, ask your clinician about sleep apnea screening. For those diagnosed, CPAP or other therapies can be transformative. How it works for erections: sleep is hormone orchestration. Deep and REM sleep preserve testosterone's natural rhythm and support the parasympathetic nervous system. Nighttime erections occur during REM, oxygenating penile tissue and preserving responsiveness, a nightly workout without leaving the bed. Sleep fragmentation and apnea rob you of this maintenance, elevate cortisol and constrict blood vessels. Restore the rhythm, and desire and performance have a stable stage. Evidence in friendly language. Men who improve sleep hygiene and treat apnea often notice better energy, mood, and sexual function within weeks. In clinical reports, men with obstructive sleep apnea who use CPAP experience 3 to 4-point improvements on the IEF5 over several weeks, along with more frequent morning erections. Better sleep consistency is linked with improved erection hardness scores and a lower need for medication adjustments. How to apply: anchor times. Choose a consistent 7-8 hour window. Protect it like an important appointment. Light and caffeine. Get 10 minutes of morning light. Keep caffeine earlier in the day. Many men do best with a cutoff before noon. Wind down 60 minutes before bed. Dim lights, warm shower light, reading, no news scroll. Bedroom cool, dark, quiet. Consider white noise if needed. Apnea clues: loud snoring. Witness pauses in breathing, dry mouth, morning headaches, or daytime sleepiness. If these ring true, ask for a sleep study. CPAP, if prescribed, give it 2 to 4 weeks to adapt. Fit and comfort improve adherence, and benefits tend to build as sleep consolidates. Medications and interactions: review sedatives, alcohol, and late-evening antihypertensives with your clinician if you feel dizzy at night. Alcohol shortens REM and fragments sleep. Keep it modest and earlier. When to see a doctor? You suspect apnea. You wake gasping. You have morning headaches or uncontrolled blood pressure. Sudden drop in libido with fatigue or depressed mood. Restless legs, frequent nighttime urination, or chronic snoring. Tonight's checklist. Set a consistent bedtime for the next 7 nights. Place your phone to charge outside the bedroom. Open the curtains upon waking for a 10-minute light reset. If you snore loudly, message your clinician about apnea screening. With the nightly rehearsal restored, our final lever calms, the nerves strengthens the pelvic floor, and sets practical boundaries with alcohol and smoking. What it is. This secret blends slow breathwork, pelvic floor training, Kegels done correctly, gentle hip and thigh mobility, and clear evening boundaries around alcohol and nicotine. We add a brief vascular warm-up, simple movements that nudge blood into the pelvis before intimacy. How it works for erections. Erections favor the parasympathetic nervous system, the rest and respond pathway. Slow breathing, for example, or 6 breaths per minute, activates it, lowering sympathetic overdrive that can shut erections down. Proper Kegels strengthen the muscles that help trap blood in the penis, improving firmness and control. Mobility work reduces pelvic tension and improves comfort. Capping alcohol prevents REM loss and vascular constriction. Smoking cessation removes the nicotine clamp on blood vessels. Evidence in friendly language. In clinical programs, men who practice pelvic floor training and slow breathing for 8 to 12 weeks reported firmer erections and better control, with IIF5 increases of 3 to 4 points and higher erection hardness scores. Reducing evening alcohol and stopping smoking improve endothelial function and flow-mediated dilation, the blood vessel's ability to open on cue. Patient story: Mr. Andrew, 65, Miguel worried mostly about performance anxiety. He would lose focus, then firmness. We set a simple routine, 5 to 10 minutes of slow breathing nightly, a Kegel plan more on that below light hip stretches, and a firm limit of 1 drink finished before 8 p.m. After 8 weeks, his erection hardness score improved from 2 to 3, and his IIF5 rose by 3 points. I stay present, he said. I am not fighting my body anymore. How to apply? Breath work, sit or lie down. Inhale through the nose for 4 to 5 seconds, exhale gently for 5-6 seconds. Aim for 5 minutes nightly. On stressful days, try 10 minutes. Kegels done right. Find the muscles you would use to stop gas. Gently contract for 3 to 5 seconds, then relax fully for 5 to 7 seconds. Start with 10 reps twice daily. Avoid bearing down or tightening the abdomen, thighs, or buttocks. Build toward 3 sets day, then maintain. Mobility: add 90-90 hip rotations to gentle hamstring stretches and low squats with support 5 minutes daily. Vascular warm-up before intimacy. 2 minutes of easy air, squats, hip circles, or a short walk up and down the hallway to cue pelvic blood flow. Alcohol tuning. Many men perform best with 0-1 drink finished 2 to 3 hours before bed. Smoking cessation. Talk to your clinician about nicotine replacement medications or coaching. Each smoke constricts penile arteries and damages the endothelium. Interactions and cautions. If you have pelvic pain or recent prostate surgery, get pelvic floor guidance before starting. If you are on blood pressure medications, slow rising from bed after breathwork. If you use PDE5 inhibitors, remember never combine them with nitrate medications. Discuss alcohol limits to avoid dizziness. When to see a doctor? Persistent pelvic pain or urinary symptoms. Ongoing performance anxiety with intrusive thoughts, consider brief cognitive strategies or counseling. Lightheadedness with alcohol or breathwork routines. Tonight's checklist: 5 minutes of slow breathing after brushing your teeth. 10 gentle Kegels twice today with full relaxations. 1 short set of hip mobility before bed. Decide your alcohol boundary for the week. If you smoke, choose a quit aid to discuss with your doctor. You now have 4 coordinated levers. In part 5, let us pull them together and chart your next step. Here is my invitation: pick 1 lever tonight. A walk after dinner, lights out on time, a beet and citrus salad, 5 quiet minutes of slow breathing. Small moves stack quickly when they aim at the same target: healthy pressure, steady sugar, and deep sleep. The reward is not only in the bedroom. Men tell me they feel clearer, stronger, less anxious, and more connected. If this conversation helped, tap like and subscribe, and tell me in the comments which habit you will start tonight. Your story might be the nudge another man needs to feel confident again. I have linked a free one-page erection-friendly habits checklist below. Print it and keep it on your nightstand. If you have warning signs, chest pain with exertion, painful erections that persist, a sudden drop in desire with heavy fatigue, a brand new onset of ED or heart disease that is not under control, please schedule with your clinician. When you are ready for a deeper dive, watch our next episode on the heart metabolism sex triangle, how cholesterol particles, arterial flexibility, and stress chemistry influence performance, and what to do about each one. This video is for education only and does not replace personal medical advice. Talk with your own clinician, especially if you have heart disease, take blood pressure medicines, or use nitrates.